artificial urinary sphincter is part of the armamentarium for the treatment of stress urinary incontinence in women who suffer sphincter deficiency. The legacy device, IMS 800 from Boston Scientific, past IMS, is used since more than 35 years, at least in France, because it's marketed and labeled for that. And we, at least in my department, but also in the routine practice in France and some countries in Europe, we are used to implant it in women who are suffering severe incontinence and who are bothered by incontinence when they walk, when they stand up, or when they suffer some urethral urgency. So this device, IMS 800, is a very good device, even if there is a need for a pump in the major labia. There is a fixed pressure with a pressure regulating balloon. And the new device we are presenting at this SUFU meeting, it's an electronic one. The male study has been done, the pilot study, and we did also the pilot study in women. And I will present the first woman who has more than 1 year follow-up with this electronic device, including a cuff, exactly as with the legacy device. But the control of the pressure and the control of the voiding phase is made through a control unit, which is placed at the abdominal level subcutaneously. And the patient will be able to void using patient remote control to open the cuff, which will spontaneously open when they push on the button, and the system will close by itself when the time of voiding phase is finished. So this is exactly the same device as we use for the pilot study in men. But in women, the main challenge is that the cuff has to be implanted around the bladder neck. And the bladder neck dissection is a challenging dissection in some patients who suffered past surgeries. We are used to do it since a long time because we use a previous device. When you know how to dissect bladder neck, the implantation of this device is not easy, but it's quite easy to learn and to do. And such a way, patient is able to become quickly dry, not wearing any pad anymore. I will present the result of the first woman who has been implanted with this new device. I would say it's worldwide the first patient who has been implanted with an electronic device which has been activated and followed at least 1 year. This patient, she was suffering tremendous incontinence with 4 pads per day and 125 grams of leaks at the 1 hour pad test, which is a way to evaluate the severity of incontinence. And after implantation, which went well without any injury of the bladder neck or the bladder or the vagina, she has been activated at 6 weeks. And after activation, she started to be dry and not to leak anymore. So she doesn't wear any more pads. And now at 1 year, the pad test, the 1 hour pad test has been done again as it's part of the protocol. And she suffered 4 grams of incontinence on this test, opposed to 125 at the beginning. So she is voiding using the patient remote control, and she is able to use a specific programming of the system where at night she pushed on the lying down button. It means that at night she reduces the pressure inside the system to protect urethra. And when she wakes up in the morning, she starts again to use daytime pressure to be fully dry in everyday activities.